I work for Northeast Independent School District, and we are a large school district in the northeast quadrant of San Antonio. And you can kind of see up there on the map where Northeast is. Anyone been to San Antonio? Did you land at the airport? Okay. We're right, the little part that where we're not grayed in, that little, where it comes up like that, that's the airport. We do not get their tax dollars. But that's where we are. And so you probably flew over NEISD when you flew into the airport. Like I said, we're a large urban school district. We have about 68,000 students. We are changing in our diversity. We are now, our free and reduced lunch population has increased over the last probably 15 years. So now we're dealing with more socioeconomic challenged students and families. And so several years ago I was hired, about 9 years ago I was hired to address asthma, because the superintendent saw that our demographics were changing and we knew we would have kids that would be at risk. So I'll go ahead and get started with the presentation. I think those of you who are in healthcare, who's all in healthcare, who works in healthcare, we've known for decades that asthma impacts academic performance and attendance. But what's nice is that finally, school district administrators and people in the public education arena are making that connection. And so these are just some studies that have come out with the relationship of school absence, academic performance, and asthma. As well as when you look at education reform, you have to look at attendance. You have to. And then finally, what's come out recently, and this is from the P16 Plus Council in Bexar County, and actually it's all over the nation. This is the P16 Plus is basically a group of business leaders that kind of come together to help raise the level of academic and educational opportunities for their students in their area. And this council did a study, and they actually looked at why they interviewed parents from across the city and asked them why their child was missing school. And when they did that data collection, first of all, there were three things in their initial assessment. Parents unaware of the importance of attendance. Second was health issues, and tied with second was transportation. So they did this outreach to all these families and raised the awareness of the importance of attendance, and they did that for a year. We had public service announcements all over the city about the importance of attendance in schools and things like that. So after that year, they came back and they polled parents again. And they looked at the top two issues that surfaced were transportation and health. Now the health issue, parents identified as asthma was the reason why kids miss school. And that's important because school districts don't necessarily track why a student misses school, because that's really parents, they have to offer that information. And that's something that's not normally tracked because of HIPAA and everything else. You can't just come out and ask why a kid misses school. So this is very important because it really does highlight from a third party that asthma is impacting attendance in schools. And so we need to understand that. And so when you look at this, and when you look at this P16 study, that's considered chronic absenteeism if you miss more than 18 days. And their data also reflected that if you're chronic absentee, you have a 50% higher chance of dropping out, as well as becoming academically at risk because of your reading level and things like that. So at this point, y'all all have straws at the end of your pews. We're not in a church, but they're pews. And so go ahead and grab a straw. And I want you to stand up, open the straw, lean them back there in the back. And I want you to take your straw out. Even you have to take the straw out as a package, put it in your mouth, breathe through the straw, pinch your nose, and I want you to jump up and down while you're breathing through the straw. I want all of you guys to do that. Now while you're doing that, I'm going to move on. So when you look at the attendance piece of asthma, you have to realize that attendance doesn't necessarily tell you the whole picture. Keep jumping. Doesn't tell you the whole picture. Because schools may come out and have a 96% attendance rate, and so they think, okay, we're good. But you've got to look at the smaller population of the number of people of that 4% that are missing schools. They are typically the same children. Okay, y'all can stop now. How'd y'all do? Who heard what I said? Anybody hear what I just said? What were you focusing on?
Staying upright.
Breathing, right? I don't think I need to go further into the academic performance if you have asthma. Because this is how those kids feel every day. All right, if they're in a classroom that has a bunch of triggers, do you really think they're getting that math lesson? No, they're trying to just breathe. And so when I present to school district administrators and staff, I make them do this because they are directly related to the air that child breathes. So now we talked about the academic piece. Let's take a little closer of that small population and the cost that may be going on with the school district. This is NEISD is attendance funding, and we are reimbursed by the state for attendance. And so we have over 8,000 asthmatics in our school district. The CDC says that a child with asthma may miss up to 8 days. Of course, we know there's some that miss less, and then we know there's some that miss 30. Okay, so that's an average. Our daily rate by the state reimbursement is $32. So if we did nothing within our school district to manage asthma, we have the potential to lose over $2 million. Now that's a lot of money. That is a lot more than my salary. Trust me, a lot more. So now I asked, and Debbie gave me y'all's information on Fulton County. Y'all have over 10,000 asthmatics. Your daily rate is $53.75. So if your school districts do nothing, they have the potential to lose over $4 million. I think I should come work here and ask for a commission. So anyway, you have to think about the money because school districts are very tight budgets, very tight budgets. And so, you know, the argument is, and what I talk to school district administrators is that you need to make sure you're spending some of that money on maintaining healthy environments for your asthma students, but all students. And you kind of do that when you address the environment for all asthmatics. Now, as we saw earlier, there is a human cost of asthma. Now, the thing here, what people don't sometimes realize, is that death from asthma can actually occur no matter what level of severity you have. And it's pretty much evenly distributed across the board. So these are your persistent asthmatics, whether severe, moderate, and mild. Now what's interesting is most people think, well, it's the severe asthmatic that has the more potential to die. When actually that's not true because they're probably on the controller meds because it's such an issue in their life. It's that mild asthmatic that I worry about the most. And I'll share my personal story. My father was a mild persistent asthmatic. He had maybe an exacerbation once every 2 years. He died from an asthma attack. And it's because he wasn't taking a controller med, despite his daughter's nagging. But anyway, you'll hear more about that later. I was a severe asthmatic as a kid. And so I missed tons of school. I still can't diagram a sentence in English because I missed so much of my 7th grade year. And so I was in and out of the hospital. I didn't have a quality of life. I didn't think I could exercise. I go off on, you know, the Girl Scout, you know, camp out, and the second night my parents were picking me up. So my quality of life really suffered. But I'm here today, a very controlled asthmatic. And my son has asthma, and he has he's probably a moderate persistent asthmatic, and because his mother's a respiratory therapist, his asthma was in control, and in fact, he did anything he wanted to do. His life was not limited. He was a first chair all-state-based clarinetist in the state of Texas, and you cannot do that if you cannot breathe. And so I know the full gamut of life with asthma, the best and the worst. And so my whole goal is to make that awareness piece to all of our parents and our staff in NEISD. And I'm just going to go through some pictures here of some kids who actually died at school across the nation. And I'm not going to get into these, but I think the highlights when you look at this is the reliever medication didn't work. I love the line here from Mickey's mom. We knew asthma, we figured Mickey's asthma was a way of life. We never thought for a minute it would be a way of death. And this is a little guy from Aldine, Texas. He had his inhaler in the nurse's office, but he didn't quite make it, and the treatment, he did not respond to the treatment. Here's Mercedes. Again, taking her albuterol, but it wasn't helping. And yeah, even athletes can die from asthma. This is a senior high school student. She was well controlled, but over the last few days, she'd been taking her MDI frequently. She was out of control, but she thought she was well controlled. And she was in the bus traveling to regional playoffs. They hit the farm to Market Road, which in Texas, that means it's a dirt, dusty road out in the middle of nowhere. And she died on the bus on the way to the hospital. So why did these kids die? These kids died because they didn't know their severity of disease, and they didn't realize that they were being impacted by asthma. And this was a study that was done several years ago of pediatric patients that went to see their pediatrician, not for an asthma visit, but just a routine visit. And they did the asthma control test on the asthmatics, and 48% of them had uncontrolled asthma, but that's not why they were there. They were there for strep throat. They were there for a sprained ankle. They were there for different things. And so we have to really educate people on what it means to be in control and set that expectation. So how do you do that in a school setting? Well, what we do, and what's supported by the American Lung Association, the American Association of School Administrators, is that asthma management involves medications and environment. You have to have a comprehensive asthma management program, and you have to provide an asthma-friendly environment. And like I said earlier, if you provide that asthma-friendly environment to your most sensitive occupant, you're going to create a healthy learning environment for your entire population, students and staff. Now we in Northeast, this is some data here on the side. Northeast has a 12% asthma prevalence rate. But we have some campuses that have an 18% asthma prevalence rate. So every school is unique and every school is different. So let's talk about what asthma is. And this is kind of how I explain things when I present to people who aren't familiar with asthma to kind of raise their awareness piece. Asthma is genetically predisposed, but it's environmentally induced. Okay? That's like a lot of diseases out there. Those genetic inducers are dust mites, cat dander, cockroach, mold, and secondary smoke. If we do not maintain our facilities, and when you see some pictures, you'll see what I'm talking about. If we don't maintain our facilities, we actually can induce the development of asthma. Once asthma develops, then that person is then hypersensitive, and then that longer list of triggers that Richard was talking about play into that. Okay, they play into it. And when you look at the asthma slide up there, asthma development above that middle airway is the inflammation that's going on in the airway. Once that happens, then that's when they become hypersensitive to the environment around them. When an asthma episode happens, then you have the bronchoconstriction. The death of those students is because all they could get to was the bronchodilator. They didn't address the inflammation inside the airway, which is the underlying cause of asthma. The bronchodilator is just a temporary Band-Aid on a bigger problem. So we really have to push that use of those inhaled corticosteroids, because that's the only drug that gets rid of the inflammation inside the airway. Now, when all this happens and the child is exposed to the environment, those are the costs that you see in the yellow box to an IST. We have loss of instruction time, loss of focus in the classroom. We have emergency room visits. We lose attendance. And unfortunately, death can happen as well. So how do you fix this? It takes medication and environment. And healthcare tends to focus on the medication side because that's what they have some control over. They can write a prescription for that. It's kind of hard to write a prescription for no dust mites. You know, we can teach them, but with the healthcare system the way it is, physicians don't have that kind of time. And in reimbursement rates at different states, not all states reimburse asthma medication. So it has to fall on other people. And that's where, in the school system, we have a really unique role to do that. So anyway, it takes the medication and the environment, and when you look at what that looks like, you can see why parents get confused. Because on the medication side alone, all those inhalers can be confusing. You know, and they'll say, well, I use a red inhaler. Well, there's a red inhaler in every row, okay? But they all have different actions. They all do different things. And so we have to educate parents on that use of that medication. And of course, we use the EPA technical solutions to address the environment in our school system. So when I started the program 9 years ago, I used the 6 key drivers from the EPA, and I have a degree in business. It made no sense to me. It's basically a business model. Let me go back here. And you look at the 4 components of asthma management from the national guidelines. And what I did is I basically took those 4 components and put them into something that was adaptable to school districts. The asthma guidelines are kind of written for one-on-one healthcare to patient, and I kind of tweaked them to be 1 to 8,000. I'm the 1, and I have 8,000 students with asthma. So when I created the program, I created a program that would meet the needs and address all of our stakeholders with asthma. So first thing I did is I assessed our school environment, and what I found, is this working? Yeah, is the number of EMS calls we had, and we had over 120 EMS calls in 1 year. Since asthma is a completely controllable disease, that was totally unacceptable. We had to find a solution to that. And then I did a quality of life survey. And in the white box, you can see what the definition of asthma control is. And a lot of people don't know this. And so this is where we ranked, where we were as a school district, kind of our snapshot. The national guidelines say that you should not miss school or work from asthma. Yet when we surveyed parents, 53% were experiencing absenteeism. In one cluster, in our lower income cluster, 6% of the parents were, the child was missing more than 10 days. And that was my high, it was 10 or more. So it could have been 30, it could have been 18, it could have been a bigger number. No interruption of class time due to symptoms. They should have a normal quality of life, and we had over 70,000 visits to the school nurse in a year. No use of inhaler more than 2 times per week. 85% of our parents said that their children were using the reliever medication for symptoms. No coughing during the night. 75% stated that their child was waking up coughing at night more than 2 times per month. Participation in all physical activities, 77% were limiting their physical activity. And then, of course, like I mentioned earlier, no emergency or urgent care visits. 25% said they had visited the ER or the urgent care facility in the last year. And, of course, the 120 EMS calls. Now, there's a couple things I want to point out here. That no use of inhaler more than 2 times per week. The challenge in the school system is that you have to communicate with the parents and the physician of what's going on, because you don't necessarily know how often that child is using the reliever medication at home. We only know how much they're using it at school. And if the guidelines say no more than twice per week, are the 2 entities talking to know that you've passed that 2 times per week? And that's a challenge. That's why parents and the school nurse, or whoever's administering that reliever medication in the school system, needs to communicate on the frequency of the use of that albuterol. Okay? The other issue is no coughing during the night. I don't know about you, but if I don't sleep good, I'm not my most productive the next day. And I remember going to, when I was a kid in school, if I had a rough night and I was up coughing, a lot of times my mom would let me sleep in because she needed to sleep in because I interrupted her night as well. And so you go back to that P16 survey about transportation. If the asthmatic is a bus rider, okay, and they've been up all night using, having to use their inhaler and having a rough night, and they've slept in, they've lost their mode to get to school. So I have to wonder if that transportation, because we offer, if you live 2 miles within the school district, you're on a bus, you can ride the bus for free. And so I have to wonder, and that's a state law. So I have to wonder if that transportation issue that the P16 Council discovered as a reason why kids miss school, if asthma is not related with that as well. And then finally, the participation in all physical activities. This generation of students, it's an obesity issue. We all know that our students today are, they have a higher propensity of obesity than we did growing up. And the solution of that is they need to learn an active lifestyle. And so if we're teaching them or allowing them to be sedentary because of lack of control of their disease, or asking for even a worse generation that really is going to have a lot of underlying health issues. Not only will this child be an asthmatic, they may be diabetic, and they may be obese. So now we've got healthcare costs when they're in their 30s that are going to be astronomical. I then looked at staff and parent needs, what they understood about asthma, and then I also looked at the environment. And I asked why they get sick at school. What's going on? What are we doing wrong? And so through all that, through the six key drivers, I basically, by addressing the environment, I now created an environment that was healthy for everybody. So what does that look like? So this basically is my dashboard that kind of talks about the different things that I've done over the last 9 years. Again, it's using the 4 components, and I created objectives for each component. And then what I did is I basically addressed those 4 components to meet the needs of all of our stakeholders, our parents, our students, our staff, and our community. So when you look at all this stuff, now granted, this is 9 years worth of work. So don't think you can go out there and, oh, I'm going to do this tomorrow. It took time, and it took a lot of assessment and evaluation, and then more plan and more action. And so over time, this is what we've developed. And again, it's fluid. I'm still adding things. And so within the awareness piece, one of the things we did is we needed to raise parent expectations. And sometimes my worst parents to get to are the ones who were asthmatics themselves. Because, well, I had asthma and I did fine. I didn't have to take all this meds, so why, maybe my kid doesn't need it. And so we really have to set those parent expectations to be higher than what they probably are. And that means my child should be normal. My child should not be doing better or he's doing good. He should be normal. And that's what we have to strive for. We also created Health Check, which I'll explain here in a little bit, as well as we utilize the asthma control test. We have a physician reassessment form that we can send out to that primary care physician if the child is not meeting national guidelines on asthma control, and also a referral system where I can refer patients to pediatric pulmonologists, allergists, or the Children's Hospital of San Antonio. So we've created those partnerships with physicians and facilities around the state, the city. The education piece, I'll get into that, but basically we want to provide disease management strategies to every stakeholder. So there's many things that I do there, from teachers to parents to students, and I'll share some pictures of that. Like I said, I'm reinventing it. I'm adding to it every year. This year I rolled out AIMS, which is the asthma incentivizing management skills. And spirit sticks are real big in our elementary schools. They're like the little merit badges. You were a scout, girl or boy scout. They're little spirit sticks. And I developed spirit sticks on asthma management. So there's 7 of them, and so as the child learns different disease management strategies, he earns a spirit stick. So that's been a huge, the kids love it, so they're going for that. And then finally on the environmental side, we've done different things, and I'll go into that more specifically.